Have you ever wondered what methocarbamol is used for? If so, you've come to the right place. Methocarbamol is a medication commonly prescribed by doctors to treat muscle spasms and pain. Whether you've experienced a muscle injury or suffer from a chronic condition, methocarbamol may provide the relief you need. This powerful muscle relaxant works by blocking nerve impulses sent to your brain, effectively relaxing your muscles and reducing discomfort. It can be used as a standalone treatment or in combination with other medications, depending on your specific needs. In addition to its therapeutic benefits, methocarbamol is known for its minimal side effects, making it a popular choice for many patients. However, as with any medication, there are potential risks and dangers associated with its use, which we will explore further in this video. If you're curious about the applications, benefits, potential side effects, dosage, and potential dangers of methocarbamol, this video will provide you with all the information you need to make an informed decision about your healthcare. So let's dive in and uncover the many facets of methocarbamol. What is methocarbamol? Methocarbamol is a medication commonly prescribed by doctors to treat muscle spasms and pain. It belongs to a class of drugs known as muscle relaxants and is primarily used to provide relief from acute musculoskeletal conditions. These conditions can include muscle strains, sprains, and other muscle injuries. Methocarbamol is also used to alleviate pain and discomfort associated with chronic conditions such as fibromyalgia and multiple sclerosis. The mechanism of action of methocarbamol involves blocking nerve impulses or pain signals sent to the brain, effectively relaxing the muscles and reducing discomfort. By targeting the central nervous system, methocarbamol helps to relieve muscle spasms and improve flexibility and range of motion. It is available in oral tablet form and is typically taken by mouth with or without food. Methocarbamol is often prescribed as part of a comprehensive treatment plan that may include physical therapy, rest, and other interventions. It is important to note that methocarbamol is not a cure for the underlying conditions causing muscle spasms or pain, but rather a tool to help manage symptoms and improve quality of life. Now that we have a basic understanding of methocarbamol, let's explore its applications in more detail. Applications of methocarbamol. Methocarbamol has several applications in the field of medicine due to its muscle relaxant properties. One primary application is the treatment of acute musculoskeletal conditions. When an individual experiences a muscle injury, whether it be from a sports-related incident or a strain from everyday activities, muscle spasms and pain often accompany the injury. Methocarbamol can be prescribed to alleviate these symptoms, allowing the individual to recover more comfortably. In addition to acute conditions, methocarbamol is also used to manage chronic musculoskeletal conditions such as fibromyalgia and multiple sclerosis. Both of these conditions can cause widespread muscle pain and stiffness, making it difficult for individuals to perform daily tasks. Methocarbamol can help reduce muscle spasms and improve mobility, providing much-needed relief for those living with these conditions. Furthermore, methocarbamol can be used in combination with other medications to enhance their effectiveness. For example, it is sometimes prescribed alongside nonsteroidal anti-inflammatory drugs, NSAIDs, to help relieve the pain associated with muscle injuries. By combining these medications, patients may experience more significant pain relief and improved overall outcomes. The versatility of methocarbamol in treating both acute and chronic conditions makes it a valuable tool in the medical field. However, it is important to understand the potential benefits and side effects before considering its use. Let's explore the benefits of methocarbamol in more detail. Benefits of methocarbamol. Methocarbamol offers several benefits to individuals suffering from muscle spasms and pain. One of the primary advantages is its ability to provide rapid relief from acute musculoskeletal conditions. When taken as prescribed, methocarbamol can help reduce muscle spasms and alleviate pain within a relatively short period, allowing individuals to resume their daily activities more comfortably. Another benefit of methocarbamol is its minimal sedative effects compared to other muscle relaxants. While methocarbamol can cause drowsiness, it is generally considered less sedating than some other medications in the same class. This can be particularly advantageous for individuals who need to remain alert and functional throughout the day. In addition to its muscle relaxant properties, methocarbamol may also have some secondary benefits. Some studies suggest that methocarbamol may have anxiolytic, anti-anxiety effects, potentially helping individuals with muscle-related anxiety or tension. However, further research is needed to fully understand the extent of these benefits. It is important to note that the effectiveness of methocarbamol may vary from person to person. While many individuals experience significant relief from their symptoms, others may find limited or no benefit. Discussing your specific situation with a healthcare professional can help determine if methocarbamol is the right choice for you. Now that we have explored the potential benefits, it is essential to understand the potential side effects and risks associated with methocarbamol. Potential side effects of methocarbamol. Like any medication, methocarbamol comes with potential side effects. While many individuals tolerate methocarbamol well, some may experience adverse reactions. The most common side effects of methocarbamol include drowsiness, dizziness, and lightheadedness. These effects can impair alertness and coordination, making activities such as driving or operating machinery potentially dangerous. It is crucial to use caution when starting methocarbamol and avoid activities that require mental alertness until you know how the medication affects you. Other less common side effects may include nausea, headache, blurred vision, and dry mouth. These side effects are typically mild and resolve on their own. However, if they persist or worsen, it is important to consult a healthcare professional. In rare cases, methocarbamol may cause more severe side effects such as allergic reactions, including rash, itching, swelling, severe dizziness, or difficulty breathing. If any of these symptoms occur, immediate medical attention is necessary. It is important to note that the side effects mentioned above are not exhaustive. Different individuals may experience different reactions, and it is essential to consult a healthcare professional for personalized advice. Additionally, certain populations may be at higher risk for side effects, such as older adults or individuals with pre-existing medical conditions. Always disclose your medical history and current medications to your healthcare provider to ensure the safe use of methocarbamol. Now that we have discussed the potential side effects, let's delve into the dosage guidelines for methocarbamol. Methocarbamol dosage guidelines. The dosage of methocarbamol can vary depending on the individual, the severity of symptoms, and the specific condition being treated. It is crucial to follow the prescribed dosage instructions provided by your healthcare professional. Taking more than the recommended dose can increase the risk of side effects, while taking less may result in inadequate symptom relief. Typically, the initial recommended dosage for adults is 1,500 mg, 3 500 mg tablets, 4 times a day, or 750 mg, 1 750 mg tablet, 6 times a day. The dosage may be adjusted based on the individual's response to treatment and any potential side effects experienced. It is essential to communicate any changes in symptoms or concerns to your healthcare provider to ensure appropriate adjustments are made. For individuals with impaired kidney function, dosage adjustments may be necessary. Methocarbamol is primarily excreted through the kidneys, and impaired renal function can affect the clearance of the medication from the body. Your healthcare provider will determine the appropriate dosage based on your kidney function and overall medical condition. It is important to note that children and adolescents under the age of 16 should not typically be prescribed methocarbamol due to limited data on its safety and efficacy in this population. However, in certain cases, a healthcare professional may determine that the benefits outweigh the potential risks and choose to prescribe it off-label. Now that we understand the dosage guidelines for methocarbamol, let's explore the precautions and potential dangers associated with its use. Precautions and dangers of using methocarbamol. While methocarbamol is generally well tolerated, there are precautions and potential dangers that should be considered before use. Firstly, individuals with a known allergy or hypersensitivity to methocarbamol or any of its components should avoid taking the medication. Allergic reactions can be severe and potentially life-threatening, requiring immediate medical attention. Additionally, it is important to disclose your complete medical history and any current medications to your healthcare provider before starting methocarbamol. Certain medical conditions, such as liver or kidney disease, may require dosage adjustments or close monitoring while taking methocarbamol. Similarly, certain medications may interact with methocarbamol, potentially affecting its efficacy or increasing the risk of side effects. It is crucial to provide accurate information to your healthcare provider to ensure safe and effective treatment. Pregnant or breastfeeding individuals should exercise caution when considering methocarbamol. Limited data is available on the safety of methocarbamol in pregnancy or lactation, and its use should be weighed against potential risks. Consultation with a healthcare professional is essential in these situations to make an informed decision regarding medication use. Furthermore, long-term use of methocarbamol should be carefully evaluated. Prolonged use can lead to physical dependence or tolerance, requiring higher doses to achieve the same level of relief. Abrupt discontinuation of methocarbamol after long-term use can also lead to withdrawal symptoms, such as anxiety, insomnia, and muscle aches. It is important to work closely with your healthcare provider to develop a plan for safe and effective long-term use or discontinuation of methocarbamol. Now that we have discussed the precautions and potential dangers, let's compare methocarbamol to other muscle relaxants commonly used in clinical practice. Methocarbamol versus other muscle relaxants. Methocarbamol is one of several muscle relaxants available on the market. Each muscle relaxant has its unique properties, advantages, and potential side effects. Comparing methocarbamol to other muscle relaxants can help individuals and healthcare professionals make informed decisions about treatment options. One commonly prescribed muscle relaxant is cyclobenzaprine, commonly sold under the brand name Flexeril. Like methocarbamol, cyclobenzaprine works by blocking nerve impulses or pain signals sent to the brain, providing muscle relaxation and pain relief. However, cyclobenzaprine is generally considered more sedating than methocarbamol and may have a higher risk of anticholinergic side effects, such as dry mouth and blurred vision. The choice between methocarbamol and cyclobenzaprine may depend on the individual's tolerance for sedation and the specific nature of their symptoms. Another muscle relaxant frequently used is baclofen. Baclofen primarily acts on the central nervous system to reduce muscle spasms and improve muscle function. Baclofen may be more effective for individuals with spasticity or conditions such as multiple sclerosis. However, baclofen has a higher risk of causing muscle weakness compared to methocarbamol. The choice between methocarbamol and baclofen should be made in consultation with a healthcare professional based on the individual's specific needs and medical history. Other muscle relaxants, such as carisoprodol and tizanidine, may also be prescribed in certain situations. Each muscle relaxant has its unique characteristics and potential side effects. It is important to discuss the options with a healthcare professional to determine the most suitable choice for your specific condition. Now that we have compared methocarbamol to other muscle relaxants, let's explore its veterinary applications and usage in animals. Methocarbamol for animals' veterinary applications. Methocarbamol is not only used in humans but also has veterinary applications. In the veterinary field, methocarbamol is commonly used to manage muscle spasms and pain in animals. It can be prescribed for conditions such as muscle strains, sprains, or injuries, similar to its applications in humans. Methocarbamol is often used in combination with other medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, to provide comprehensive pain relief in animals. By targeting both the muscle spasms and inflammation, methocarbamol helps improve the overall comfort and mobility of the animal. The dosage and administration of methocarbamol in animals vary depending on the species, weight, and specific condition being treated. Veterinary professionals will determine the appropriate dosage and treatment plan for each individual animal. It is important to note that methocarbamol should only be used under the guidance of a licensed veterinarian. Self-administration or using human medications on animals can be dangerous and may lead to adverse effects or ineffective treatment. Always consult with a veterinary professional to ensure the safe and appropriate use of methocarbamol in animals. Now that we have explored the veterinary applications of methocarbamol, let's discuss alternative treatment options for muscle spasms and pain. Methocarbamol alternatives. While methocarbamol can be an effective treatment for muscle spasms and pain, it is not the only option available. Several alternative treatments and approaches may provide relief for individuals seeking alternatives to or in conjunction with methocarbamol. It is important to note that the suitability of these alternatives may vary depending on the individual's specific condition and medical history. One alternative treatment option is physical therapy. Physical therapy focuses on improving mobility, strength, and function through targeted exercises and techniques. A physical therapist can assess your condition and develop an individualized treatment plan to address the underlying causes of muscle spasms and pain. Physical therapy can be particularly beneficial for individuals with chronic conditions such as fibromyalgia or multiple sclerosis. Another alternative approach is complementary and alternative medicine, CAM, therapies. CAM therapies include practices such as acupuncture, massage therapy, and herbal remedies. These treatments aim to address the whole person, considering physical, mental, and emotional factors. While research on the effectiveness of CAM therapies for muscle spasms and pain is limited, some individuals find relief through these approaches. It is important to consult with a qualified practitioner and discuss potential interactions with any medications you may be taking. Additionally, lifestyle modifications may play a role in managing muscle spasms and pain. Regular exercise, stress management techniques, and adequate rest and sleep can all contribute to overall well-being and symptom management. A balanced diet rich in anti-inflammatory foods may also help reduce inflammation and alleviate muscle pain. It is essential to work with healthcare professionals to develop a comprehensive treatment plan that incorporates these lifestyle factors. Now that we have explored some alternative treatment options, let's summarize the key points discussed in this video. Conclusion. Methocarbamol is a medication commonly used to treat muscle spasms and pain. It works by blocking nerve impulses to the brain, providing muscle relaxation and alleviating discomfort. Methocarbamol has applications in both acute and chronic musculoskeletal conditions and can be used in combination with other medications to enhance their effectiveness.